Yeah, I mean, so many topics today. Wow.
Yeah, it's very impressive.
I do, it's interesting just thinking about the sort of the way that a lot of these talks leaned was almost, I think, if you kind of had a tone meter on the day, I'd say that there was a little bit leaning towards it's kind of tough. It can be a grind. I mean, Ian's talk. I know we're already kind of diving into the rehash here, but Ian's talk leaned a little bit, you know, not negative, but like lean type, like this is hard. It can be
Takes
hard
time.
switching between remote and then Jules and Bridget and the panel. But one comment really stood out to me today so far, which is Jules saying, kind of saying that going remote and pivoting and changing things up gave her the chance to heal and also do the things that she needed to do vis-a-vis starting a family.
Hmm.
And that's like you only live once. I mean, to be able to afford yourself that opportunity by changing your work environment and pivoting and stuff like that's huge. And I really that resonated and that felt good for me to hear for her that she was able to do that. And that made me realize that there's really a lot of like we're all doing this because we like it. We could all go back to medicine. All of us who are on the panels and talking today could go back to medicine. We didn't like lose our licenses or anything. So
Hmm.
um, we're all still doing this for a reason, and we're doing it because we're able to accomplish for several reasons. One of them is we're able to accomplish kind of life dreams, life goals, or at
Hmm.
least try to get do it right. So we don't, you know, hit 80 years old and say like, "Wow, I never really gave myself the chance to do that." And maybe that for many people, it's that they want to have a life of service and at the bedside and feel really accomplished in hands-on patient care, and that's fantastic, and we
Hmm.
need that. But for others, it's like I want to build a company, or I
Hmm.
want to be an influencer, or I want to just try something totally different and see where it leads me,
Yeah.
and not wake up tomorrow and say like I didn't do that.
Yeah.
So
Yeah. I think that the tone is right for the times. Like if we were having this conversation in 2015, like when it was startups and places like Facebook, Meta were just like totally overstaffed, like crazy benefits, just spending money like crazy. Like everything was just rainbows and butterflies, in these companies. Like it might be a little
unicorns,
different,
rainbows and unicorns.
I think that this is realistic. And again, like I said in my talk, like we're right before the inflection point. Like we're right there. So if people are interested in this transition and want to do it, now is the time because it's only going to become more of a professional option for us as nurses. And to begin getting prepared now, you're ahead of the wave of people that are going to try to get into this. And yeah, it's a lot about the lifestyle you want to live and things like not commuting saves a significant amount of time. It's not trivial and it opens up, your time for other pursuits and other focuses, whether that's family time or starting businesses or you're cooking a breakfast in the morning. So what I wanted to do to summarize is kind of a fun thing, I think. So have you heard of the Feynman technique? I think you have a psychology background.
Hopefully I'm about to. I'm about
So
to.
the Feynman technique, apparently, we're not going to do it exactly, but it's when kind of before bed, you break,
The Feynman technique.
yeah, you break down your day into little bite-sized words, and it's a way to solidify the learning. So you kind of like go through your whole day and just think about what happened in bite-sized chunks, like little. So we're going to do that with my little notes that I wrote down. And we don't need to have commentary necessarily, but feel free if it sparks something, because then it'll just solidify it more and, make it feel like the day was even more robust than it was. So we're going to start. Should we start with the morning and go through the day, or
Let's
should
do
we
that. Yeah, I
start?
like that.
Okay.
Keep
All
it
right,
going.
ready?
Yeah.
Screen side manner.
Yeah, that's I suppose it's I'm just supposed to have like the first reaction for a quick reaction or something.
Yeah.
Okay, kind of like game show. Okay, and then the button. What is screen side manner? I mean, on the one hand, it's like cheeky, it's cute, it's a plan, a traditional clinical
Hmm.
term that's really meaningful. Like honestly, I think of all the terms in that describe the practice of medicine, bedside manner to me is always one that matters a ton. And I think I'm just kind of formal on presentation and appearance and
Yeah.
connection. And I think that that's just like
Connection.
that
Hmm.
and the laying on of hands, like that, those two
Hmm.
concepts. I mean, they go together, right? But it's critical. So screen side manner, I mean, it says it's kind of in a cheeky way, but but
Hmm.
honestly, I think I'm going to use that. I'm going to put that in
Me
my
too.
quiver.
Love it. Okay, we're gonna go quicker. I wrote down a lot of things.
Okay, I didn't realize it.
Your audio's a little choppy. I think it's better when you're closer to the screen, just so you know. I think, yeah, cool. Okay, pivot position. That was also from Ian's talk. Sense of purpose. So that was a theme today for sure. I think I talked about that. Ian talked about that. The afternoon speakers did. So that's critical. I have been in that boat. I still am in that boat some days where I just feel this immense pressure to just apply to jobs or figure out some way to accelerate my pursuits and make money. Like we're always under this pressure of money. And that's just how our society works. So it's hard to kind of check that and make sure that you're only pursuing things that give you a sense of purpose. But I do think that that is where you're gonna end up in a place where you're gonna want to stay, and all of that pursuit and time was worth it versus rushing and then maybe just wasting time and ending up in a place that you're really unhappy. So I think that's a big theme for today.
That's such a quick comment. That sounds like something that you should probably check in on a lot, right? Like it doesn't, just check in on it once and then set your course for the rest of the duration.
Yeah.
Probably every 12 months we're checking in.
Hmm. Guidelines, not protocols. I liked that a lot, especially for remote work. There's going to be times when you're going to need to have make some calls, and that's good. Yeah.
Yeah.
We talked a lot about certifications. I'm going to leave that there. I think that we
Go back
covered
and
that.
watch the replays. Yeah.
I love this whole POTS thing, plain old telephone service. That was the original telemed. Um, let's see, policy importance. All right. So how do we, when we're thinking bigger picture nursing profession, and making this remote career path a real thing and making it attainable, I think we're all going to need to be paying attention to the legal and political scope, especially when it comes to insurance and billing codes and the nursing scope of practice as well.
Yeah.
Mhm. Diversity, that was a big theme. DEI, diversity, equity, and inclusion.
Yeah. The
Unlearning.
only thing to say there is that, I mean, I think look, I mean, not to tie in a lot of shadow nurse kind of commentary here, but yeah, we're talking to a lot of people out there who are representatives of major healthcare brands or patients or heads of patient services and things like that. And the number one thing we're hearing is the need for diversity
Mhm.
to meet their patients where they are. And I love it. I mean, I think we're going to be well situated when we're ready to really launch things in that perspective to deliver on that need. And it's really super important. And it's a make or break kind of importance
Mhm.
to the success of something like this. Really, any kind of remote work.
Mhm. Absolutely. Unlearning. I liked that idea. Going into a room and pretending like you're learning again for the first time.
Yeah.
Quantifiable, right, on your resume and metrics and trying to show, the impact that you've made on your resume and on your applications. Um, our own sense of identity as you're thinking about remote roles to apply to and where you want to be and live your life. We talked a bit about non-clinical people making job descriptions.
Sorry, just answering. There's somebody had a kind of a situation pop up, so I'm just addressing it.
Okay. What is the impact I'm making? Healthy cooking, morning routine, and your car ride. That resonated with me. I roll out of bed and get on my laptop a lot. That's that. Jules, thanks for checking me on that one. Open mind and honest. If you are confused about anything in communications, just pick up the phone, have a phone call. Feedback is valuable. Positive sandwich. And
Positive sandwich. Okay, so sorry, I'm back. I love the positive sandwich. The only thing about the sandwich is you gotta feed the person the sandwich in a way that they don't know that they're getting the sandwich. Because if the person receiving it is like, this tastes an awful like a sandwich, then it just kind of it makes it a little bit.
Mhm.
It takes away from the authenticity of
Yeah,
it.
that's what Bridget said is
Yeah,
hard to
she
make
said it.
it
Yeah,
sound.
and I think Bridge
Mhm.
is probably really good at the delivery. But the first couple times you try it, you might be like, oh wow, that sounded like that. If it's just sounds like and tastes like a sandwich, then it's a sandwich. You know, the other person's gonna realize and be like, I think you're just trying to feed me a sandwich here. Like,
Yeah.
which I mean, good for trying, but it's a lot of these things they sound easy. Again, maybe
Yeah.
that's the point. Sounds easy, and then when you're in the throes of it and your guns up and your heart's beating and you're confronting somebody, I'm not good at confrontation. So it's not going to come out the way Bridget says it unless you're Bridget. So, but you still got to try. Like it's a skill. You just got to practice.
Yeah.
It's a
Yep. The more you do it.
winner.
All right. Great. All right. So tomorrow we'll be around at 8:30 Pacific again, and Jeff will kick us off with a quick opening. I'm going to go over some resources. Then we have a lot of info on ChatGPT, AI, machine learning. There's another.
Tomorrow, I mean, everyone's got other spacesuits on. It's gonna like we're gonna be going from like uh, drag racer speed to like rocket speed tomorrow. So come with your notes ready and your
Yeah,
spacesuit on.
it's going to be fun and exciting. And less of me, more of other people. So, all right. Well, that's all I had for wrap up. Did you have anything else, Jeff?
No, so we're gonna. So here's the thing: we've got. It's getting late on certain coasts. So we want to do the networking, but we may do it in one room, just depending on how many folks are there. So why don't I'm gonna go ahead and open up the room here in just a couple minutes, and we have a corporate roles room, and we have a remote nursing room. And so depending on how things shake down, we were anticipating that you could just jump back and forth. But depending on how many people show up, because I know some folks just may want to get to dinner or have to pick up kids from soccer practice and stuff like that. So depending on how many, we may just point is we may just consolidate into one room. Hopefully we can figure that out on the fly.
All right. Okay,
Cool.
sounds good.
All
See
right.
you there.